because I'm sitting on my foot.
Oh, cheater.
Sorry, that's how I sit.
Is it crooked? Maybe it is crooked. Doesn't it? Okay. This is the worst part because I know it's recording. I watch it later. See? Worst part of the video. The very beginning.
You can't face... Oh, gotta tell my kid he can't FaceTime me. Can't FaceTime.
All right. Shelby's here. I gotta show her our shirts made by Shelby Smith.
Sorry, Shelby. Viruses are jerks.
All right. Hello, everybody who is filtering in. Destiny's texting kids. She has like 33, so I mean, that's a lot of texts.
I'm always trying to FaceTime me.
So we will just wait a little bit as people join us, and then we'll get started. Hello, Donna and Sarah. Madeline. Look at all this. I saw Debbie in there and Mary Jean. Tara.
I didn't know Jean's name was really Mary Jean until Facebook.
We learn a lot on Facebook.
We do.
I don't know that I knew that either. There's Debbie.
Hey, Deb. I got your text the other day, and I completely forgot to respond. I'll respond. I promise.
And there's Heather, one of our hardworking respiratory therapists. She is ready.
Hey, Dr. Reiner.
And Dwayne. Hello. Dwayne. Hi, Dwayne. Oh, and Susie. Oh, we golf together. It's impressive.
That poor thing. Her, not you.
I know. Thanks a lot. All right. Well, we're going to go ahead and get started if that sounds okay. As always, and as it has been for the last 18 years of this pandemic, I'm Jen Bacani McKinney, and I am the Wilson County Health Officer.
And I'm Destiny Wheeler, and I'm the Health Department Administrator.
All right. So we're going to start off with statistics. And as we talked about last time, we are going to try to shorten our Facebook Live session. So please put any questions in there that you might have, and we will be happy to answer them. And we're going to try to keep it within, we're going to say 20 minutes this time. We know we're
going to do 30.
Yes. But let's just try. Let's see what happens. So Des is going to start with statistics.
Okay. So nationally, the numbers, total cases in the U.S., 6,537,627. Deaths, 194,092. So a lot.
A lot. Yes.
And then state statistics, total cases as of yesterday, 49,899. Total deaths is 534 as of yesterday at 10 o'clock, I think is what they say. In Wilson County, we have a total of 56 cases right now. We know it's wrong on the state's website. We worked with them this morning and we got it straightened out. So that will be right on Wednesday when they update again. So tomorrow it'll be right. We did have the addition of one COVID-related death in Wilson County this weekend. So that will also be on the state's website on Monday, or on Wednesday, sorry.
All right.
Great. Oh, and right now, sorry.
Oh,
we have 10 active cases, and as of Monday. Sorry. Yeah, yesterday was Monday.
Yeah, whatever day.
It's been the longest year ever. We have 1,090 negative tests in Wilson County.
All right. So again, please ask whatever questions you guys might have. I appreciate seeing people like Dr. Anschutz, Dr. Stovak also on here. So thank you. If you guys have any advice to share with us in Wilson County, we will be happy to take it.
Gladly take any advice.
How to get rid of COVID, for example, if you want to do that one. So really our, we don't have a lot of new news. It's kind of, the pandemic as usual. So we continue to ask people to wear masks. We understand we don't have a mandate here in Wilson County, but that doesn't mean that it's not the right thing to do to wear masks to protect each other. So we know that there are upcoming events that are scheduled. We don't, we are all playing it by ear as things go on. And so we want to do everything that we can to keep people safe. If you attend an event or whatever, please social distance, please wear masks and keep others safe. And we're doing everything we can to keep kids in school. And that means keeping COVID out of the schools and out of the families of the school-age kids. So That's the biggest thing. Hand washing, don't touch your face, your mouth, and when possible, avoid mass gatherings and all the usual things that we've been saying this whole time.
There really is very little new news.
Let's cover one thing. Oh, there's Dr. Gangula. So, thank you. He is the health officer in Montgomery County. So, thank you for joining us. One thing that has come up, and we've covered it a couple times, but it is important to understand that if you are a direct contact of a positive patient, there is no substitute for the 14-day quarantine. I know we've talked about that quite a bit, but we want to make sure people understand that. The almost the gut reaction is, well, let me just get tested and see if I have it. Well, you might test negative, but you still need to quarantine. Or you might test negative and maybe your viral load is not high enough to trigger the test. So our role, our purpose for making people quarantine for that long is because we know that people may take up to 14 days to develop symptoms or to become contagious and infect others. And so if we are not protecting others for that entire 14-day time, we put other people at risk. And we know no one wants to infect others. This is a highly contagious thing we've got going on, and we have to do everything we can. Vicki, let's see. Go for it, Des. To reveal. Okay.
To reveal the towns that are affected by COVID. We aren't typically doing that. It's so in a small county, people
hard.
pretty well know anyway, but it's really hard to maintain that anonymity that people deserve, because we know that just because someone caught a virus doesn't mean they did anything wrong. Just because someone's in quarantine doesn't mean they did anything wrong. They just were around someone who had a virus. So we don't want them to experience that negative stigma that we know that they will, because we aren't releasing who is in quarantine or anything like that, and we still get calls saying, oh, this person's in quarantine and they were walking their dog, or this person is in quarantine and they were checking their mail, and while we do want to make sure that the people that are in quarantine stay in quarantine, for the most part they are, but so people know. We are, the state has said that they're going to start releasing cluster information, specific cluster information. So
and that would be if there are 5 cases or more?
Depends. If it's a business, I think it has to be 20.
Okay.
But in certain areas, they're providing us the health departments with like school absenteeism reports and stuff like that. We sorry, my kid. We aren't releasing that right now.
So I think, and the main thing is we want to protect people's confidentiality, but this is still a reportable disease, and so that's why we are able to give more information probably than just your average medical condition going on. And so kind of like tuberculosis and various STDs. I mean, those are reportable diseases. They always have been, and so we're able to give a little bit more information. And the purpose of giving information is to protect others. So in this case, we talk about we can actually give the schools, I believe, the schools information.
We can give the schools some information that we can't give to just individuals.
Yeah, because we know giving the schools information allows them to be able to protect the other kids within the school. And that's the whole idea with the outbreaks and clusters. So clusters, outbreaks is kind of like, clusters is a nicer way to say outbreak.
Sounds,
I guess.
Less scary.
Less scary. Less like there's a monkey involved, like with an outbreak. So I think anyways. So that's why they are talking about giving, or that's why they are giving out cluster information, because if we know that people who might come into that setting are at higher risk for being infected, then we want to give people all the information to be able to make that decision whether they should go into that setting or not.
Yeah, and I mean, honestly, if Wilson County's not that big, if we have 10 active cases, they're probably not all in one place. So I think it's pretty safe to assume that there is it's pretty much widespread at this point.
Yeah. And so, you know,
and widespread like geographically.
Yes, not like
not like everyone's got it,
yeah,
but like geographically widespread.
Yes. Alrighty. Other questions that we have. We really are here for you guys today to ask any questions you might have. Pretty much the most common questions I think that we get are about quarantine and testing and all of that. We are still doing antigen testing in Wilson County, and we do see that the specific antigen tests that we are using, because there's different companies, different types of antigen tests. So the company that we're using, this sensitivity and specificity is reported to be in the 90s. So that's really good for any test, really. Like, for example, a rapid strep test is still maybe, oh man, I shouldn't have ventured into the numbers game, but it's much lower anyway. So if you have a negative, you're probably negative, but you have a high likelihood of being false negative, for example. So we do have very reliable tests here, and we get results within 20 minutes. There is still the option of the PCR testing. We just don't have those readily available here in Wilson County, where we can have like the quick turnaround time like we would with antigen testing. So there are pros and cons of both. It might take longer to get PCR results back, 1, 2, 3 days now, hopefully not that much.
We're usually seeing about 48 hours.
But the PCR we know is more sensitive than the antigen testing, but you just don't get the results as quick. And if you are getting tested, stay home until you get the results. Do not go to lunch, don't go to work, don't go anywhere.
Go home.
Go home. Just go home.
Even if you're asymptomatic. And that's another thing. If you are asymptomatic,
distraction.
Sorry.
Destiny's really good at distraction.
I'm so bad.
Go ahead.
It's been such a long day. No, so one of the pros of this antigen testing is that they you do get results back very, very quickly, but you have to be maybe a little more symptomatic before they register an accurate result. So we've had people go in and get tested and it's negative, and then 2 days later they feel worse, they go get tested again and it comes back positive. So there really are.
And it's not that the test was wrong the first time. It's just
there's not that viral load in your system that is high enough to set it off, basically.
Heather, do you want to talk more about that one? Like halting of the vaccine trial. I know there's multiple vaccine trials that are going on at this time, so
yeah, I don't know.
So maybe more information on that question, if you would. And Carrie, do they have to have symptoms to test? No. Actually, at this point, anyone can come in. There's what we're doing. What we have available is called a cash and carry test. So really, anybody who wants to get tested, whether they have any reason to or not, can come to the hospital. They can register, pay up front, and then get tested and have results within 20 minutes on the antigen testing. A lot of people have done this, and for whatever reason, we don't necessarily ask why. If early on in the pandemic, they were required to have symptoms because it would be sent to the state. They would not run it if you didn't have specific symptoms of COVID, and that was all PCR testing. And it was because we didn't have a lot of testing supplies at that point. So, and we do know that there are asymptomatic people that are spreading. That is, and whether they're completely asymptomatic or they just haven't started with their symptoms yet, we're not exactly sure. Oh, Brian Murison, $50.
Yep.
So he asked what the cost of the cash and carry is. So, and it's 24/7 on that one as well for the cash and carry. But you want to let people know, either call ahead or call from your car, so that you don't just walk up and you're like coughing into a hospital worker's face or something. Let them know ahead of time. But
yeah,
asymptomatic spread, I think I was mentioning, but I forgot what we were talking about. Anyways, that's why Destiny and her hardworking team at the health department, they will go back a couple of days, 48 hours, to ask who you were in contact with before you 48 hours before your symptoms started, I believe.
Yeah, that's how we determine who you have infected. Now, we do ask if you've been around anyone who's been ill or if you've been to any mass gatherings, so that we know where you may have gotten it. They still scrape the brain ones.
So Carrie, actually, we're doing nasal swabs. That is one for the antigen. I think the antigen ones. We talked about them being nasopharyngeal still, right?
I don't know.
Either way, you're still getting them.
It's pretty deep either way.
In the nose. But they do have saliva tests that are coming out. We don't have them here. We talked about that a little bit. We don't have them here. They're a little bit cheaper. You still have to like hack up some good stuff. It's not just going to be a little, so I think about my brothers when they would like hover over me when I was a kid and dangle a spit. Did your
my mom did that to my cousins though.
Oh, that's so gross.
So gross.
Right? But it was a thing. Thanks, brothers. But so it's a little bit more than the dangly spit. It's a little bit of good stuff to get the viral particles in there to test. And their sensitivity and specificity, I looked it up today. It's actually close to what the antigen testing is. So, but we don't have that available right now in Wilson County. Oh, look, we're doing a good job. We told you we're cutting back on our time so that we make sure that you guys can get back to what you're doing every day, whatever that is. I don't know. Hopefully not catching COVID.
Hopefully. Yeah.
And Heather, you mentioned the vaccine trial. I'm not sure on the answer to that one. I know with all these trials, that's why it's so hard with the vaccines, right? Is that every vaccine trial of all the vaccines that there's ever been or attempted to be, they have to go through multiple levels of those different trials, the different parts of the trial. And so because we know that the animal studies went well, but what happens when we actually try them in humans, and what happens then when we try it in a lot of humans? You're always going to get some sort of side effect. And do the side effects outweigh the benefits, or do the benefits outweigh the side effects? And that's really how every vaccine is going to work. So even this vaccine, we fully expect that there's going to be side effects, but are more lives going to be saved from the vaccine, and there are just few side effects in few people, or not? That's how we decide if they're good enough.
Yeah. And Heather, they may nix that one and start over, but there are several going on right now. Basically, every vaccine manufacturer in the world is trying to make a vaccine. So
And probably multiple.
yeah. Okay, so this question is, are we aware of what protections employers are required to keep in place regarding testing for employees, even if the person is asymptomatic? My job is currently requiring that we have 6 of the 15-ish common symptoms before we get a test done. Unfortunately, there is no requirement for employers to provide protections. We hope that they are, and we have worked with several employers to try and make workplaces safer. So
Right.
far, I mean, it really is up to the employer to do that. I would suggest that if you are ill or you've been around someone who's ill and has tested positive, that you just go
And get tested.
and
right?
get tested, and then but there's no requirements right now.
And that is kind of the hard part with, it makes me think of like the emergency declaration that the governor just re-upped. So we are still in a state of emergency in Kansas, which then allows some of these executive orders and stuff to stay in place. I will just say, like, our kids are doing a really great job with wearing masks right now. And that's one of the executive orders that kids will wear masks in school. And speaking to the administrators and the teachers, our kids are not complaining. There's probably
They're
a
probably
handful,
complaining.
but
Yes,
yes, but they're wearing them, and and they're protecting each other, and it's really encouraging to see, because they get it, and they also see their friends wearing masks, and it's okay, and we know it's not comfortable. There's not a single person that loves wearing a mask. I just want to point that out. Like, we don't love it, and nobody else does, and nobody loves having to put a mask on their kids, but the kids are really thriving and doing well right now.
They really are doing well, and I think the numbers kind of speak to that. The mask wearing. I was talking with some folks from a different county, and they have a much bigger school than our school systems, and they've had 10 kids test positive in 3 weeks. So nowhere else is that probably going to work.
Yeah.
If the school's not taking the precautions, if they are not socially distancing and wearing masks, those numbers would be way higher, because we know that it is very contagious. So so they really are just, it really is working. There are going to be cases, because these kids aren't in school 24/7, and even if the work is taking every precaution, they're not in work. You're not at work 24/7. Most of us.
Most of us shouldn't be.
Yeah,
Sometimes.
but it really is working. The numbers, they keep going up, but
Not
we
in our
aren't
kids.
seeing these larger employers have tons and tons of cases, and we're not seeing the schools have tons and tons of cases, because they are doing such a good job at socially distancing, and the masks seem to be helping. I mean, they help.
Yeah.
It all work. It all seems to be working.
We do we do work closely, like speaking of the employers, we do work closely with the employers. They have been reaching out to us and asking for advice, and I think their intentions are to keep people safe, because if you are safe and healthy, you come to work and you're productive. And so I really have that sense that our businesses are trying their best, you know. So yeah. How did I get up on the executive order thing? Oh, so there's no requirements by the state. That was the whole point of that. There are some things that the state has put in place, like the emergency declaration, like the masks in schools, Executive Order 2059, things like that. But in general, the businesses are hopefully doing their best, but they don't have any requirements at this time. All right, we're going to do a last call for questions. If anybody has any questions for us. I definitely scratched my nose. Man.
I coughed into my hand.
Oh, see, we're going to it's okay. We're going to dip each other in hand sanitizer.
No, we're not.
Not really. That's a lie. That would be gross. And we don't have a vat that big. I mean, no. Just in case you were wondering if it's off screen or something. It's not.
Yes, yeah.
All right, so we are actually, our plan is to do our Facebook Lives now monthly. So we actually will be back, what did we say?
October 13th.
October 13th. All right, and we're going to do 4 o'clock. If you have questions in the meantime, let us know. And what I would really encourage people to do is, when in doubt, please call the health department or call your primary care doctor, your primary care provider, and just ask questions. Please don't be shy. If you aren't sure, ask, and we'll help guide you through this. Because as we even talk through, this person was a contact of this person who was around this person, and blah, 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 blah. There's a lot of mapping we have to do and figuring out. It sounds like it could be black and white, but it never is.
It never is.
So we want to help you, because we know it's complicated even on our end. So we want to help you navigate your way through to keep you safe. All right? Anything else?
I can't think of anything.
It's a stressful time still for people.
It is incredibly. And there are a lot of people going in and out of quarantine all the time, and we just please have some grace. There are some. I do want to say, if you get a call from Kara or me, and we say you've been identified as a possible contact of a COVID-19 case, that's not our fault. It's not your fault. And 95% of the time, it's not the person who has COVID's fault. So, yelling at Kara is not going to help anything. And Kara gets yelled at a lot. So, because she's doing the majority of the calling. So, please have some grace. Oh,
that is something that came up.
Yeah. Oh, that's a good question, Kim. So, modified quarantine for essential workers. That is a very good idea. Thanks, Kim. Modified quarantine for essential workers in Kansas includes healthcare workers, first responders, law enforcement,
Yeah.
dispatch. You know, if these people stopped working, society would shut down. Like,
Yep.
like, yeah, if the entire health department is put in quarantine, we can't put anyone else in quarantine. So we've still got to come to work. Now, we can only come to work. We can only come to work. We've got to wear a mask the entire time. Working home, that's it.
Mm-hmm. And
that's
the second piece, I think, like eyewear. I think you have to do like 2 pieces.
Yeah,
of,
probably a eyewear or goggles or a face shield as well. But that is what modified quarantine for exposure.
And it's been kind of confusing because when we had the lockdown, the stay home order, there was this long list of like essential workers, right? And that was important at the time because who could even go to work? Could we even allow people to go to work at all who have had no symptoms, no contact, no nothing? Well, that list no longer is in play. So that's where it gets kind of confusing, that list is no longer essential workers. Now the essential workers are the ones that Destiny mentioned, and those are the only ones that can do modified quarantine, right? And the rest of the world has to do quarantine. So if you are at a common one on that list was like any type of manufacturing, like all kinds of manufacturing. If you work in a manufacturing plant or whatever else it is, you still have to do full quarantine where you stay home and don't leave your house at all.
Yeah.
So just to clarify that, because that is a great point to bring up. Thanks.
And yeah, I'm not gonna say that. Change my mind. Yeah. So we're trying to call it critical infrastructure instead of essential workers because that kind of has been used and it is a little confusing because it's the same exact words, but we're not talking about the same exact thing.
Yep. So I will go back to, please don't yell at Destiny and Kara for doing their jobs. And please, honesty is really good right now. So if you're like, oh no, I don't even know that person. Why would they identify me? That's probably not helpful either. So make sure we're just trying to keep people safe. So please play along, and it's really to protect others. Okay, on that note, anything else? Anything else? Last call. All right. So, and Destiny was saying, please have grace, take care of each other. It's stressful, and we're past 6 months of doing this, and people are suffering, and we know that, and it's a really challenging time for everybody, whether you're affected directly or not. So please be kind to each other, and there is only one way we're gonna get through all of this, and that's by helping each other out and protecting each other. So thank you guys, and thank you to all the people who are out there working, swabbing, taking care of people who have COVID or not, or who take care of people who are in their homes because they are kind of trying to keep themselves safe. I mean, there's a lot of great people out there.
There are, and there's a lot of people working really, really hard.
And a shout out to our health department again. I just have to say, they were here this weekend. They're here in the evenings, making phone calls, answering questions. So, you don't hear before this. You didn't hear much about what health departments did. You would get your vaccines. You would maybe go in for WIC or whatever else. I mean, and that's what they did, and it was essential. I mean, that was important for lives. But oh my gosh, these guys are we have
we're super popular now.
They're working their butts off. So I just want to make sure everybody knows that. So, all right, you guys, October 13th.
All right. If you have questions between now and then, feel free, call the health department, send them to us in Messenger. We will answer them as quickly as we can. And if we don't answer, remind us because we get a lot of messages.
Yes, we're not ignoring you.
No, not on purpose anyway.
Thank you. Take care. Stay safe.
Thanks, everybody.
Bye.